Welcome to 23 Degrees Sideways. Healthcare is not a right. The reason that healthcare is not a right and cannot be a right is that it relies on the work, it relies on the efforts of another person to provide that to you. You can't make that into a government-mandated right. You cannot say that I have the right to your service, your time. However, and this is going to be shocking to the half of you that don't think healthcare is a right, providing access to healthcare for all is a valid moral duty, responsibility, and goal for a technologically advanced society. It is a valid societal goal and duty to make sure everyone has access to healthcare. And I'm not going to say that society cannot use any government forms to fulfill that duty. I'm not an anarchist, okay? But I think that we are leaving out both breadth and depth in our healthcare system by trying to operate things strictly on a government mandate, especially since this is not a historical model. The idea of nationalized healthcare and the single payer and everyone gets it no matter what, which never seems to actually happen, that is a primarily 20th century development. It's not from Rome, it's not from Athens, certainly not from Athens. I mean, talk about a stratified society. This idea really develops from the hyper-nationalism of the 20th century. In the early part of the 20th century, in the United States, perhaps not most, but much of our healthcare was provided at low cost through cooperatives. They weren't always called co-ops because that's a legal term now, but they were cooperative endeavors. You had fraternal organizations, clubs, unions, and other cooperative membership groups. And they would band together, and part of what they would do is take your dues and contract a doctor, contract some level of health care for the members of the club and their families. The AMA and the hospital administrators, hospital businesses, and academia worked together, and in the process developed another interest group of medical insurance companies to lobby the government to remove this basic system that we had, where we were using co-ops, where many hospitals were actually nonprofit. All of that went away, and we went to the big regulated guild model. And that's a problem where government regulation doesn't always create what people think of as capitalism. When people blame capitalism's failures, they're often actually looking at a government-mandated, government-regulated, government-enforced guild or restriction system. So that's a broader topic. It applies very much in the medical field. The AMA made it more difficult to get health care, deliberately, to increase its power. It wanted to increase power over doctors, over regulation. The AMA acts as a regulatory body and is no part of the government, and increase profits. That was their goal. The American Medical Association shut down a large part of our access, our affordable access to health care. Hospitals. Hospitals originally were basically, in the early 20th century, a hospital was where you went to die. While that improved a lot in the early 20th century, the rebranding of hospitals was a huge effort in corrupting our medical system. Now, there's always stratification. And I realize I seem like I'm jumping around, but these are important concepts that we have to get dealt with. There's always stratification of care. There will always be richer people, more powerful people who get better care. there really is no way to get rid of that. And it's okay. The first thing you have to understand is that it does not help anyone on the bottom tier to tell someone on the top tier that they're not allowed to have care. The goal here is to make the societal duty is to provide good, adequate, better, constantly improving healthcare for everyone. Okay? That does not mean taking away from the top tiers. The goal is not to reduce the access for richer people. The goal is to increase access and performance for the poorer people. Focus on that and stop with the idea that it has to be negative, that you have to take away from someone. Zero-sum games don't work with humans. So, originally, we had a highly religious model. Now, we had a patronage model at the same time, and they were very closely related. Okay, so a rich person in a country would donate large amounts of money, funding, land, building, to a religiously operated, not-for-profit, non-profit hospital or medical research institution. Remember that a lot of the big universities are religiously founded and, at least in the past, have been religiously funded also. So the biggest advance, the change in model to actually providing healthcare, like the idea of providing healthcare to large segments of the population, is religious. But the nonprofit sector, which includes religion, we might need to give them back healthcare in order to perform our societal duty. Other nations were experimenting with hypernationalism and authoritarianism and developing single-payer or nationalized healthcare systems. Understand that these are a solution that does not. The National Healthcare Service idea is a solution that does not have a long track record. This is not something that dates back to Rome or Athens. Certainly not Athens. You'll never see a more stratified and less equal access society in the Mediterranean than Athens. Okay? So, this idea of the nationalized healthcare system, everything under one roof, is very new. And it still has class and access scaling. No matter what your healthcare system looks like, there are going to be people at the top with better access. There are going to be people at the bottom with lesser access. That's going to happen. If you're in the goal is to provide the maximum amount of good access to the maximum amount of people. And so instead of trying to take away from the billionaires, what you want to do is try to increase your lower tier access and quality of healthcare. Focus on that, not on whether or not Bill Gates has a private doctor. Doesn't matter. Don't care. Not a problem, okay? Don't even think about it. If your societal goal is to provide better healthcare for everyone, start with that bottom. Try to work on that. Try to make sure that the healthcare access gets better for everybody. Wow, what's next? Well, how about churches? You need churches and religions back in healthcare. There. That should get 3/4 of the people listening livid, okay? Let's take a look. Throughout history, healthcare, when it comes to advances and actually providing healthcare, has mostly been religious. Religions have done the biggest job of increasing, advancing actual on-the-ground healthcare out there, okay? That still is the truth today outside of Western Europe and the United States and Canada, okay? It's still religions that are doing the brunt of the work. there's a myth. Well, there are a couple of myths. One myth that religion is just inherently evil and everything it does is bad. Total myth. Not going to talk to you about it, okay? Religions, nonprofits, charitable groups, and ideologically charitable groups provide huge amounts of benefit to societies all over the world. They will continue to do so despite authoritarian governments, and they could be doing a much better job if the governments in question would allow them to. The idea that the other problem with religion is that I've been arguing this for about 35 years, and there's a myth that's been, since day one, since my first high school discussion about this, there's a myth that if you let religions be involved in healthcare, all the gay people are going to be sent to camps and die. There's a couple variations to the myth, because you'll have like the polyamorous people or the transgender, transsexual people, or whatever the word is today, will all be denied access to healthcare because of religious bigotry. So it's a myth. When you look through the history of healthcare, it's pretty mythological, okay? You don't go to a hospital and have the priest look at you and say, "Oh, you're not Catholic, we won't treat you today." Okay, outside of like 1630s in Germany, which was totally different kind of situation, that doesn't happen. Right now, today, you can have a Pentecostal missionary provide medical care to actual pagans, and he's not going to say a word. Okay? That's about as fundy as you can get. Pentecostal. Or Foursquare. You can get someone from a Foursquare church out there doing a mission. They're not going to say anything. They're not going to deny you access to health care in Africa because you worship trees. Okay? Nope. It's a myth. What's not a myth is how that works in the modern pseudo-religions of science. So, recently in Medscape, a medical ethics letter from an actual medical ethicist claims that people should not receive care for Corona 1984 if they do not practice his approved model of social distancing. If you do not behave properly, you should not receive health care. That is science. That's Medscape, and that is a basic progressive, anti-religious, but still basically essentially religious. They're anti-theists, but they follow their own religion. They have dogma. They have rules. They have heretics. Okay? That is a religious view. It is a atheist religious view, but it is a viewpoint. And I've never, ever, ever found this when dealing with actual churches. I've never been somewhere where a Catholic hospital turns people away. I have, however, been listening to progressives in America, and I don't mean this necessarily as political progressives, just ideologically progressive people. A lot of them are conservatives or libertarians. I have been listening for 8-10 years now to progressives in America say that people should be denied access to health care if they are anti-vaxxers, if they are white, if they didn't wash their hands enough, if they don't do coronavirus right. If they don't do what you want, you should be able to deny them access to health care. Nonprofits, religious groups, charitable organizations should be much more involved in healthcare. And that does not mean that I think that government should never step in. I understand that there's a place for government assistance. I live in a rural area where a critical access hospital is sort of a necessary piece of funding if we're going to have a hospital at all. And in terms of national security, national defense, there's a reason to have distributed health care like that. There are reasons for government assistance. There's reasons for some government funding involvement, but government should not be mandating anything about health care or how to receive health care. Okay? I think society can do a much better job at that. Now, one of the reasons that it looks like these nationalized healthcare systems do so well is that they came at the perfect moment in history. You had hyper-nationalism and growing authoritarianism and a very, very progressive elitist. One of the things I talk about with progressivism is there's an idea of elitism. I know how you should behave, so I get to tell you whether or not you get health care based on my elite knowledge of your behavior. That's progressivism, very much based on elites. You had a very progressive 20th century. Elites telling other people what to do, caring for other people, deciding what's best for them. Heavily authoritarian and highly nationalistic. Hyper-nationalism was a feature of the 20th century that got us these nationalized healthcare systems, which only really succeeded, only really got a jump because that was also a period of time, the early 20th century, when we really put in place the top 3 medical advances of all of history. Hygiene. Hygiene is absolutely far and away number 1. It's been developing since the 1600s. As people get better clothing access, you've saved a ton of lives. Just clothing, just woven fabric. But going all the way through hand washing for doctors, germ theory of disease, bedding, doing the laundry in the hospital. Like, people literally used to not wash the sheets between patients. All the stuff. Fresh air, hygiene has saved more lives, done more for medicine than anything else in history. Hands down. Well, hygiene really took a jump in the early 20th century. At the same time, you had antibiotics, which do what hygiene can't, or cover when hygiene fails, whatever it is. Antibiotics created a market for misuse, but antibiotics themselves, definitely number 2 on my list of top 3 medical innovations that allowed things like national health services to actually work. Okay, they transformed hospitals from places to die to places to get better, and you have to be hospital-based to run a national healthcare system. Number 3 is a little difficult. A lot of people would put number 3 as vaccines or advanced surgery or something, and I don't think so. I think number 3 is actually comfort care. The idea that when someone's sick or recovering, you take care of them in a way that does not damage them. So there, I've given you 4 things to think about with healthcare. I think a very good solution to healthcare is to eliminate the government mandates and get the healthcare back in the hands of nonprofits, especially religious foundations, churches. 2, healthcare is not a right. Okay? 3, it is a duty and a goal of a moral society to provide healthcare for everyone it can to the extent that it can economically and technologically do so. 4, hygiene is the single largest improvement in medical care in all of history. So, there's your 4 sideways things. I hope you get to have a lot of fun thinking about them. And until next time, stay sideways.